So, hello. My name is Dr. Carolyn Newberry, and I'll be serving as your host today during Physician Spotlight. I'm excited to be speaking today with Dr. Berkeley Limketkai, who is an associate professor of medicine down at UCLA. Dr. Limketkai, it's a pleasure to be speaking with you today.
Pleasure to speak with you as well, Carolyn, and thank you for this invitation.
Sure. So, I was hoping you could just start by telling us a little bit about yourself.
Yeah, certainly. So I went to medical school at University of Cincinnati, and thereafter I went eastward towards to Baltimore, where I did my residency, gastroenterology fellowship, as well as advanced training in inflammatory bowel diseases at Johns Hopkins. I thereafter pursued the Nestle Nutrition Fellowship, and as my first job, I was recruited on faculty at Stanford. And since then, I've actually then migrated now to sunny Southern California at UCLA.
That's great. And why don't you tell me a little bit about how you decided nutrition was going to be a part of your clinical practice?
So during my early years in training, I recalled, a fascination with biochemistry, metabolism, and digestion. I had not recognized an interest in nutrition at the time. This was more solidified when I started gastroenterology fellowship, and I found myself taking time outside of electives and rotations, shadowing and learning from the nutrition support teams. And then my further interest in nutrition had been solidified as I, pursued my PhD dissertation in a field of nutrition and GI, specifically looking at the role of vitamin D in the pathogenesis and severity of Crohn's disease. When I then transitioned to my first job, I think that was a pivotal moment in me really getting immersed in it when I was recruited to build and lead a GI nutrition program at Stanford, which was quite the tall order at the time for someone who just graduated. And it was actually a very enriching and educational experience. And I think that's what sealed the deal. And here I am now, even though I'm not necessarily in that same capacity at UCLA. I still integrate nutrition into my practice and into my research, and as I build the Inflammatory Bowel Disease Center at UCLA.
That's really interesting to hear. And as a fellow gastroenterologist, I'm always excited to talk to GIs that are incorporating nutrition into their practice. Tell me a little bit more about your experience when you started your first job at Stanford and sort of what it was like to build a program that tall in order as such a junior faculty member.
Yeah, so at the time it was actually quite daunting, and so there were several areas that I need to address. Number one is making my nutrition background and foundation much more robust. Secondly, being able to understand what are the pillars of a workable program or functional program, and then thirdly is being able to juggle between as a junior faculty trying to even grow a career as well as fulfilling your work responsibilities and in addition to that, family life. There is life outside of just work. And so I had actually spent some time with Ryan Hurt at the Mayo Clinic and also spent some time at the Cleveland Clinic. And I had mentioned earlier about the Nestle Nutrition Fellowship to be able to get a solid foundation while at the same time learning how different processes and how different programs function at these top tier institutions. I was then able to actually bring back some of that knowledge and some of the understandings of the operations and slowly but surely building it up there. But at the same time, what I actually found very important were the people you work with. And so I had a very wonderful team, of a dietitian who was very dedicated, very passionate about what she did. And she went way above and beyond the call of duty, as well as a nurse and nurse practitioner who dedicated a lot to this endeavor. I also had a very supportive chief at the time. And so I say that, beyond just what one can bring to the program, it's also, who you work with. And that's actually what helps, bring it to success.
Right. I mean, absolutely. And it sounds like that was a really enriching experience so early in your career.
Certainly was.
Yeah. And how does your life look now? I mean, what is your typical day or week now? Like, what are you doing with your time? Clinical work, education, research?
hmm Yeah. So one of the factors that attracted me to UCLA was this opportunity to yet again build a program, and in this case, it was part of the Center for Inflammatory Bowel Diseases. Where we'd focus on the tripartite mission of academia would be, clinical care, as you mentioned, education and research. My primary, given my interest in nutrition, I really try to integrate that into really all of the above. And, my primary clinical and research focuses actually are at the intersection of IBD and nutrition. So in terms of what I actually specifically do, I spend 50% of my time, seeing patients. And so that's a clinical care aspects of it. And the other 50% of the time would be really everything else in between. But then if you consider, how our work is, it's usually probably 200% of the time. So that's how I actually try to allocate my time for my different responsibilities.
Right, absolutely. And to protect some of that time, are you grant funded, or is there an internal funding that allows you to do that?
Yeah, so this is where the chief can be a very powerful ally. And in this case, the chief has been extraordinarily generous in affording me this 50% extra time for admin/research/education and all the ancillary, or not ancillary, but all the other important aspects of academics. And so this is all through internal funding. But I do have grant funding, and are continuing to apply for research funding to be able to kind of propel and grow the research program.
Right. Yeah, no, absolutely. And I think as a junior faculty member, I definitely struggle sort of finding the right balance between these different things because they all pull you in such different directions. Do you have advice for, junior faculty members or people just starting out in terms of things you wish people had told you?
Yes, and it's a very important question. And I, certainly through that experience I've had, there were a lot of stumbling blocks along the way, and learning a lot from the experiences. But if there's anything I could impart to, junior faculty or those trying to go through this career path, on one hand, it's important to have uh, great collaborators and great allies and advocates. And so the people with whom you work are important people to help you kind of carve out time to get work done, to be able to provide great advice, to be able to advocate you amidst this behemoth of a medical industry complex and the struggles of trying to balance between our revenue generation as well as trying to build your academic career, and then, as I mentioned earlier, also balancing that with personal life. The other things I would mention is that, it may actually look gloomy and grim, many a times, as you're actually trying to crawl up that academic ladder. And so perseverance and just trying to keep an eye on the prize and the end goal is really important. But I would say even more importantly is to really cherish the moment, because, we're always, in medicine, we're seemingly on a perpetual hamster wheel of the goal or the prize is just beyond us. That carrot is at the end of the stick, but we never seem to reach it. But it's really enjoying the moment and learning from what you're going through, and it will actually give you more of the energy and the motivation and the stamina really to be able to push forward. And before you know it, you look back and say, look at what I have done. Look what I've been able to learn during this time. And look at the experiences that I've been able to really share with others. And so those are the few things that I have found to be quite helpful during this time.
Yeah, and that's great to hear, especially as someone just finishing up their second year of being and attending and feeling like, you're never going to reach those goals, but I'm glad to hear there is a light at the end of the tunnel. I wanted to know if you could identify any specific mentors that you've worked with that you feel like really shaped your career.
Yeah, so in the space of nutrition, I will definitely commend Dr. McClave, and who's been an amazing mentor in many ways. He's also has an boundless enthusiasm and energy, for which I feel sometimes I'm catching up all the time. So he's actually been very instrumental in helping me shape my interest in nutrition, as well as giving great advice in terms of how to navigate the career pathway. The other person I would like to credit is his name is Dr. Mullen. He was my attending when I was in fellowship, and we did some early projects back then. But that was before I actually had fully recognized an interest in nutrition. But I continued my collaboration with him even beyond that, and as my interest in nutrition blossomed, and so did my collaborations with him. And he's been a phenomenal mentor as well, and has also provided great opportunities and great advice, similar to Dr. McClave. So I would actually, give credit to both of them, at least in the nutrition part of my career.
So I think my last question for you is how you've used Aspen to shape your career, and if you think it's a worthwhile organization to get involved with as a physician.
So Aspen has definitely been a worthwhile organization, and I'd say been invaluable in shaping my career. I would say that there are multiple facets of benefit. One being, it allows you to immerse yourself in nutrition and be amongst collaborators and, like-minded folks who have, strong passion for the field. And, it's that enthusiasm is contagious. At the same time, it also allowed me to really connect with, key opinion leaders and to really learn from the giants of nutrition, and to be able to get involved, practically speaking, on committees and on different projects that not only helped me grow in my knowledge, but at the same time really, solidified that interest and allowed me to see, many ways that one could apply one's interest and knowledge in nutrition in different ways. And it's made it a very interesting experience, to say the least. And I'd say it's very enriching and rewarding thus far. And I would recommend it to anybody and everybody who has an interest in nutrition.
Yeah, and I completely agree. I think it's been a really great organization to get involved with, and I'm excited to learn more about it as I go through my career. So I wanted to thank you for taking the time to sit down with us today during this physician spotlight. And again, this is Dr. Berkeley Limketkai, who is down at UCLA. Thank you.
Thank you very much.